Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to discuss the annoying canker sores, their causes, diagnosis, remedies, and some other valuable information for preventing them from appearing. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. Thus ulcers are another name for canker sores. These are tiny sore spots that develop in your mouth. They hurt when you eat, drink, or converse. When they do appear, they typically go away on their own after a few weeks. However, they can occasionally result in more significant problems including infections or dietary shortages. Small, painful, shallow ulcers that are found inside your mouth are called canker sores. Frequently under your tongue, in your lips, or within your cheeks. Usually, they have a yellow or white center. In the center, there's a crimson halo. They produce localized pain that makes it difficult to speak, eat, or drink. The dimensions may differ. They could show up in bunches or alone. People typically seek relief because of the agony. Canker sores versus cold sores. Mouth discomfort is a result of both cold sores and canker sores. They're not the same, though. The causes differ. Fever blisters are another name for cold sores. The herpes simplex virus is the source of them. On your lips or surrounding them, cold sores develop. These blisters are fluid-filled and infectious. Before they resolve, they crust over. On the other hand, canker sores are non-communicable oral ulcers. There is no virus to blame for them. Understanding these differences is crucial. You can choose the best management strategy and take the necessary safety measures thanks to this. Canker sore causes. Experts are still unable to determine the true source of canker sores. Still, they've identified a number of potential triggers. Acquiring knowledge of these may aid in determining the reason of your canker sores. You might be able to prevent painful situations in the future. 1. Trauma to the mouth. Canker sores can result from oral trauma. For example, accidentally biting your cheek or too vigorous tooth brushing or have dental work done. 2. Inadequate nutrients. Keratin sores may result from deficiency of specific nutrients. Iron, zinc, B9, and vitamin B12 are some of these nutrients. A balanced diet could help prevent this. 3. Food allergies. Some people experience dietary allergies or sensitivities that result in canker sores. The likelihood of developing canker sores may be reduced by locating and avoiding certain foods. 4. Stress. Your immune system may be weakened by stress. You are more likely to get canker sores as a result. Reducing canker sore episodes might be achieved by practicing stress management. 5. Variations in hormones. Hormonal fluctuations may potentially be the cause of canker sores. For instance, modifications during a pregnancy or menstrual cycle. Observing and controlling these alterations may help prevent canker sores. 6. Corresponding medical conditions. Canker sores may be brought on by specific medical disorders. For example, autoimmune illnesses or digestive problems. Controlling these issues could lead to better health. It might also lessen the likelihood of developing canker sores. How to diagnose canker sores. When examining your mouth, medical practitioners may typically identify canker sores. However, your dentist or doctor may order certain tests if your canker sores are extremely painful, unresponsive, or if you have additional symptoms. This is done in order to rule out other medical issues such as autoimmune illnesses or infections. Options for canker sore management. A definitive treatment for canker sores is not available. However, various methods can help reduce discomfort, speed up healing, and minimize complications. This section will focus on therapy in more detail. These consist of prescription drugs, over-the-counter goods, mouthwashes, topical treatments, and herbal supplements. 1. Non-prescription drugs. Analgesics and numbing lotions available over the counter may help reduce the discomfort and swelling associated with canker sores. They are safe to use for a brief period of time and are applied directly to the sore. 2. Mouth rinses. Mouthwashes may make soreness go away and help canker sores heal. Here are a few choices. Saltwater rinse. Rinsing your mouth with a warm solution of saltwater can help reduce discomfort and swelling. 1 teaspoon of salt should be dissolved in half a cup of warm water to make the rinse. For 30 seconds, gently swish the mixture in your mouth. Next, spit it out. As many times a day as necessary, repeat this procedure. Baking soda rinse. Your mouth's acidity levels may be more in balance if you rinse with baking soda. This encourages healing of canker sores. 1 teaspoon of baking soda should be dissolved in half a cup of warm water to make the rinse. For 30 seconds, gently swish the mixture in your mouth. Next, spit it out. As many times a day as necessary, repeat this. Hydrogen peroxide rinse. Hydrogen peroxide can be used to brush your teeth. You may help destroy bacteria with this everyday household antiseptic. It can speed up canker sore healing. Combine equal parts water and 3% hydrogen peroxide to create a rinse. Apply a cotton swab mixture to the canker sore by dipping it into it. Another option is to swish the mixture in your mouth before expelling it. Vinegar and apple cider rinse. Certain qualities of apple cider vinegar may aid in the destruction of oral microorganisms. However, keep in mind that not everyone will find success with it. It may aggravate the sores or make them worse in certain persons. To give it a try, combine 1 cup of water with 1 teaspoon of vinegar. For 30 seconds, swish the mixture around your lips. Next, spit it out. 3. Topical treatments. Topical medications are still another choice. They help heal by concentrating directly on the canker sore. Several well-liked options are listed below. Powdered alum. Alum powder is a drying agent that may aid in the drying of canker sores. This could expedite the fix. To use, combine a small amount of alum powder with a drop of water to form a paste. Apply the paste on the sore canker. Before you rinse your mouth, leave it there for at least a minute. Honey. Honey could reduce swelling and pain. Canker sores can heal due to the antibacterial and anti-inflammatory properties of honey. Apply honey directly to the canker sore 4 times a day. Coconut oil. There are antibacterial qualities to coconut oil. Moreover, it functions as a natural anti-inflammatory. It might lessen canker sore-related pain and edema. As needed, directly apply the coconut oil on the canker sore. Yogurt. Consuming yogurt with active probiotic cultures may reduce the incidence of canker sores. The right amount of microorganisms in the mouth is encouraged by yogurt. Aim for 1 cup or more of yogurt every day. Magnesium milk. There is magnesium hydroxide in milk of magnesia. It is stated that the chemical balances acid in the mouth. It might also lessen discomfort from canker sores. As needed, apply a small amount of milk of magnesia to the canker sore. Chamomile compress. Pain from canker sores may be lessened with chamomile. Use it by pressing a cooled chamomile tea bag directly over the sore for a short period of time. Sage. One plant that may help with canker sore pain is sage. Fill a saucepan with equal parts water and sage. After steeping, give the liquid a 30-second tongue swish. Next, spit it out. 4. Supplements and herbal remedies. A few dietary supplements and natural remedies may facilitate the healing of canker sores. Echinacea. Echinacea is supposed to reduce inflammation and boost immunity. These could expedite the healing process for canker sores. Combine 1 teaspoon liquid echinacea with the same amount of warm water. Give it a few of minutes to swish about your mouth. Then you can either spit it out or swallow it. DGL mouthwash. Herbal medicine uses deglycerinated licorice, DGL, extract. It is thought to possess anti-inflammatory qualities that could reduce canker sore-related discomfort and swelling. Combine 1 dgl capsules powder with 1 cup of warm water to create mouthwash. Before spitting it out, swish this around your mouth for approximately 3 minutes. Zinc. A crucial mineral is zinc. It aids in immune system function. Try sucking on zinc lozenges to combat the bacteria that cause canker sores. They expedite mending and support the immune system. Supplemental vitamin B complex. Candida blisters may result from low vitamin B levels. Vitamin B complex supplements may help prevent them or expedite the healing process. 5. Medications taken orally. A medical professional may prescribe oral medications like corticosteroids or NSAIDs. They aid in reducing swelling and managing pain associated with canker sores. 6. Sore cautery. Sometimes a doctor will advise trying cautery. The tissue around the canker sore is burned, seared, or destroyed by the doctor using a tool or chemical. The idea behind this is to encourage repair. 7. Nutritional supplements. One possible cause of your canker sores could be a deficiency in essential nutrients. In that case, your doctor may advise using a dietary supplement. Lifestyle and home remedies. You can reduce your risk of canker sores by making certain lifestyle and home care adjustments. These include making dietary changes, controlling stress, maintaining proper dental hygiene, and avoiding triggers. Dietary adjustments. It matters what you eat. Steer clear of meals that are acidic or spicy since these may aggravate or cause canker sores. Don't forget to incorporate essential nutrients in your diet. They might prevent outbreaks of canker sores. Zinc, vitamin B12, and folic acid, for instance. Stress reduction. Stress is a factor. It may cause canker sores and impair immunity. Avoid this by employing stress reduction techniques. For stress management, try deep breathing techniques, meditation, or professional assistance. Oral hygiene. It's crucial to maintain good dental health in order to prevent sores. Use a soft bristle brush to gently brush your teeth. Also, floss frequently. Apply mouthwash designed to treat canker sores. It's difficult to live with canker sores. However, taking precautions and reducing your risk may limit their influence on your life. The management strategies we covered in this video are ones you can try. Consult closely with medical and dental specialists to rule out any underlying health issues that may be the source of your canker sores. Recall that treating difficult or severe episodes at an early stage can have a significant impact on your oral health. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.